about all of the different ways that telemedicine can be used to treat patients. I think as a preamble, it's important to note that telemedicine has been around for over 25 years, but it was only recently injected into the mainstream of medicine as a result of the pandemic from COVID-19. Prior to that, the obstacles to adoption really revolved around two factors. Number one was the relative lack of reimbursement. It's always about follow the money, as well as the interstate restrictions. So if I'm a doctor in New York, I was unable to treat a patient who was coming online from Montana because I was not licensed in that state. Now, because of the pandemic, all of these restrictions and reimbursement, all of those have been addressed. There's now payment equity, and I, as a doctor, could treat anybody from anywhere. The question is where we go after the pandemic, but popular wisdom says that we will probably continue along a line of acceleration for adoption of telemedicine, as there's great demand from both the provider side and the patient side. So having said that, let's go over the categories of telemedicine to show you how it can be applied both now and in the future. So I will share my screen. Here we go. Now, I'd start off by saying that telemedicine is a lot more than a Zoom visit, and you will see that as these categories unfold here. So the first category is patient consults. This is doctor-to-patient interaction. And in fact, this is very, very similar to a Zoom visit, where you have high-quality video connectivity between the patient and the doctor, and video consult can occur. Now, the second category is what I call professional collaboration. Instead of doctor to patient, this is about doctor to doctor or provider to provider. And it can extend to things such as sending out x-rays to be read in India, for instance, or another country from a hospital that's overwhelmed. What's the difference between this category and the first category? Well, this also involves video connectivity. But in addition to that, there has to be a capacity for very rapid transfer of large files, for instance, images, as you can see on the screen, and also a shareable bulletin board. So there's enablement of collaboration between providers. So more powerful than that first category. Now, the third category is what I call satellite clinic medicine. This is really brick and mortar connecting to another brick and mortar establishment. And let me give you an example of this. So I'm in New York. NYU Hospital wants to extend their sphere of influence. They want to penetrate another geographic area. Let's say it's up in Buffalo, New York, 8 hours away, or maybe it's in South Carolina. They don't want to build another hospital, but they want a presence there, and they want to be able to draw patients from there. So what can they do? Well, they can rent out office space or a storefront in a mall if they like, somewhere else in another location, and then hire a PA or a nurse to man that facility. And then equip that person with a kit of professional diagnostic equipment, which may include things like an ophthalmoscope, an otoscope, a wireless stethoscope, and a wireless EKG machine, Doppler ultrasound, things like that. And so the scenario is now somebody comes into that office where the nurse resides with an eye injury off of the assembly line. So the nurse calls up NYU and gets the ophthalmologist on the line by video. The ophthalmologist says, please go into your bag of tricks and take out the ophthalmoscope and move it exactly as I tell you. And now that nurse is a direct extension of the doctor's hands, almost a perfect replica of what the doctor is doing. And it's almost like the doctor is in the room. So that's kind of a neat thing. There are other applications as well if you think about another transmitting to and from a remote location. For instance, an ambulance, which is mobile. You could put a wireless EKG machine in an ambulance, and if a heart attack patient is on their way to the hospital, that EKG can arrive before they do. And of course, another extension moving forward into the future would be remote surgery. So you've all heard of the Da Vinci robot. It's possible to put one of those up in Ice Station Zebra and have a doctor in North Carolina perform surgery from afar. So all of these are kind of neat applications, and they all fit into this satellite clinic medicine category. What I find most intriguing about this category is that it enables a hospital, for instance, to affect new forms of revenue rather than just affecting better efficiency. It can actually give them new channels to derive revenue at very little cost. So the fourth category is inpatient remote monitoring. Inpatient meaning wherever the patient spends the night. Usually this is a hospital, and this focuses primarily on emergent rooms, like a neonatal or a pediatric or an adult ICU, a post-op recovery room, a stroke victim unit in a hospital, things like that. And what occurs here is that all of the telemetry around the patient's bed, all of these vital readings, can now be shifted onto the intranet or the internet and monitored from a remote location, which could be somewhere else in the hospital, or it could be somewhere else in the country or the world. And what's the reason for this? Well, it enables the hospital to reallocate their staff. So instead of having a complement of nurses covering all of these rooms, you can have one or two people covering all of those beds, which is kind of neat. And if you look at this other picture, it's a robot that does autonomous rounds. So for instance, a doctor that's caught on the highway in a traffic jam could pull to the side and take out a tablet and call up the app and tell the robot to go to Mrs. Abrams' bed. And that robot knows how to get there. And when it does, the patient sees, if I'm the doctor, my head on the robot, I could see the patient and the telemetry around the bed in high definition. And it's kind of a neat interactive experience. Last category, home and fitness monitoring. So I'm going to break this last category up into two pieces. One is remote patient monitoring. This is, for example, when a hospital discharges a patient after surgery, if the patient happens to have a comorbidity like diabetes, for instance. Well, I might want to send them home with a glucometer and a weight scale to monitor them for 30 days or so to make sure that they stay healthy. And every day the patient steps on the scale and takes their blood, and those readings go out to a monitoring agency. And if the patient spikes, for instance, a big weight gain, 6 pounds overnight, they're probably encroaching upon a pulmonary episode. And so they'll get a call from a nurse saying, you need to get to your doctor today. This doctor will put you on medication. We do not want you back in the hospital. So it's to preempt any complications after they get discharged from the hospital. And the other half to this category is one we're all familiar with. It is the Apple Watch, Garmin Watch, Fitbit, Samsung Watch, any fitness monitor. Where does that information go? Wouldn't it be great if I had heart palpitations and I went to my doctor and they would be able to see everything that led up to that point for the last few days? So all of these together make up all of the uses in which telemedicine can be applied. I would just add to this as a last thought that technology is increasing at an incredibly rapid rate, and we're going to be faced with all kinds of abilities to promote from home. So for instance, an EKG t-shirt, that would be cheap, right? And if I'm having, as I said, heart palpitations in the middle of the night, I could put on the t-shirt, and not only could I get an analysis of the EKG, but I could transmit that to a doctor. So it may preempt a trip to the emergency room, for instance. And also new blood tests that are coming up, particularly around CRISPR technology, where we may be able to detect the onset of things like Parkinson's disease or specific viruses or types of cancer. All of this from the home. So a lot to look forward to. In a separate transmission, which I will be doing soon, I will tell you all about what we're doing at Connection to address this telemedicine category. Thank you.